first really learned about Attitudes in Reverse in 2016 when I lost my son, Owen.
I first learned about Attitudes in Reverse after I lost my son, Kobe, in 2016.
I did lose a spouse to suicide.
Unfortunately, I have had to navigate my own children in the loss of their friend and classmate to a suicide.
My children lost their father to suicide.
I had to deal with figuring out how to explain to my child, who was like a brother to him, that he lost his brother, his cousin, and I didn't know how to do that.
I think it's really interesting when you talk about mental health and the challenges people face. Often we may not know someone's going through something until afterwards, or we may not even know at all.
Trish Baker, founder, reached out to me.
At that time, I didn't know where to turn to, but so many people mentioned Trish Baker and Attitudes in Reverse and told me about their therapy dogs, and I was like, I have to meet this woman because I knew she had been through what I had been through, and I didn't know anybody else that had.
Knowing that there was someone who understood what I understood, who felt what I felt without words, meant the world to me.
I learned about Attitudes in Reverse at the perfect time in my life. I was asking myself, what purpose do I have? And I received a text message from Evelyn asking me to meet Trisha Baker. She felt that we can help the program to reach out to our community, the Latin community.
Then I learned more about Attitudes in Reverse and the mission of AIR.
AIR's impact and potential was pretty amazing.
After I saw Trisha's presentation, I knew I had to meet with her individually to bring her into our school.
I've been very fortunate to see the impact in my district that AIR has not only touched upon the students, but the staff.
We initially began with assemblies for K through 8, different types of assemblies according to their age levels and their developmental ability to access mental health supports.
Her presentation was so thorough. She offered so many resources to the students, and her presentation helped to remove the stigma of mental health.
By breaking down the stigma, identifying students that need help at that particular time, Attitudes in Reverse is making mental health approachable for all.
After the presentation on suicide awareness, we got an uptick in referrals, and teachers really took to the training and requested that AIR come back as well.
And actually we found that not only the students benefited, but also the staff. They waited every week for those dogs to come in and to spend time with our students.
AIR has made a significant impact on the students at Red Bank Regional High School. At the end of her presentation, we are able to identify students who need a higher level of care, or maybe need someone to talk to, or know of a friend who needs someone to talk to. And it is that way that we are able to identify the students who we need to see and we need to work with. It's because of this that we are able to save lives.
We also had parents trained. Trisha was wonderful and had a Spanish presentation also, not just for the parents, but our students as well.
AIR's impact and potential, it's far-reaching. I cannot believe just how many students that AIR has already reached out to.
I think one of the things that sets AIR apart from other mental health organizations is the use of the therapy dogs. My students were ecstatic. The days that AIR is in district, it spreads like wildfire. You have teachers coming down to see them, you have students pumped to see them, even administration is coming over and maybe leaving the board to come see the dogs those days. Not only is it for students from K to college, it's also for parents and for teachers as well.
The impact and potential that I see of Attitudes in Reverse, based on my experiences and interactions with the programming staff, is, quite frankly, it saves lives.
I believe AIR's impact and potential is great, especially in the Latinx community. Growing up, it was taboo to speak about mental health illness, so it's really important to share that it's okay to speak about it. So I really appreciate that Trisha Baker decided to ask us to help her out to reach our community.
AIR's impact is critical. We need to reach as many kids as possible. There is not another program that is educating parents and kids the way that AIR is. So for kids to know that it's okay to not be okay, that it's okay to reach out to a trusted adult, for trusted adults to know what to do and what signs and signals to look for is huge. We can save an enormous amount of lives, just exponential amount of lives, if we can just get air into more communities, into more schools, and to more people.
One day, the amount of kids that we were able to identify who were maybe those higher achievers, well-behaved, that often slip under the rug, we were able to really not only meet with, but connect with services, I think is priceless.
The problem is that's mostly in New Jersey. I know there are some other states that AIR is part of, but we need to reach kids in the rest of the country. And I know AIR's program is one of a kind, and it's so important, and our students do not get enough support these days.
She has touched the lives of over 3,500 students at RVR. We brought her in that first year, and she's been coming into the building ever since. It's been about 10 years, and the kids love her, and she brings in her dogs, and they absolutely love her dogs, and we together are able to save lives.
I'm just so thankful that we were able to do something to help the community and help reach the Latinx community and provide resources to kids who otherwise wouldn't know that it's okay to not be okay, to know that these things happen, that there are resources available for mental health struggles and issues, and there are ways to get help. And through Attitudes in Reverse, we can save a life.